Welcome again to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the fourth exercise and fourth video in the arthroscopic knee surgery exercise program number 2. And this is just another one of my favorite exercises. This is for balance. We're going to be testing your balance. Your balance most likely has been affected just through going through this process, as well as the time before you had this surgery done and the knee problem fixed. You were most likely having that pain and swelling and irritation, not doing the things that you typically could do or used to be able to do. So your balance was affected. Most of my patients are surprised when I have them first do this exercise, test this exercise on them. They're surprised that they've lost balance. They usually just didn't even think about that. So anyway, this exercise is called a single leg stance, but we also call this a stork stand, which is just standing on one leg. And I'll show you in a minute from the waist down just so you have a really good view of that. Just a couple things I want to say about this exercise. I want you to have something near you. So if you're going to do this just out in a room, then I want you to have a chair by you, when you first start at least, just so you know what your balance is like. If not, if you don't have a chair, you can also just do this very easily next to your kitchen table or a kitchen counter and use that for balance. So let me just show you that single leg stance. This is the starting position for this exercise. You're going to bend your good leg. You're going to be standing on your operated leg. Just make sure that your legs don't touch because that's cheating. And there's no cheating here allowed. So this is all it is. You can use this chair if you need to, or the kitchen counter or table for balance. But if you don't need it, then try not to use that. A lot of times my patients just need it for just a finger or two for a little bit of balance to start with until their balance starts to improve. If you do this exercise on a regular basis, like I will suggest, then you're going to see an improvement in your balance within the first week. It's amazing how quickly this improves. So if you don't need that chair or the counter for balance, you can put your hands on your hips like this, or you can put your hands out to the side. And if you start to lose your balance, just tap your good leg down to the ground to get that balance back. Then when you're ready to go again, just bend that knee, make sure your legs aren't touching, and go again. And this would be your second repetition. You want to try and hold this anywhere from 20 to 30 seconds or work up to that. Again, when you start to lose your balance, just put that leg down on the ground. When you're ready to start again, bend that knee and you can go again, and that would be repetition number 3. Typically, people can hold that balance. So on a normal leg, you'll be able to hold that balance anywhere from 20 seconds all the way up to 60 seconds. It really just depends on your age. Younger people are going to be able to hold that longer. As we get older, our balance just decreases naturally with age, and we aren't going to be able to hold that as long. But like I said, just compare that on your good leg, or try that on your good leg. Test that. See how long you can hold that, and that will be the goal for your operated leg. When you do this exercise, I want you to do a couple sets, so 2 sets of anywhere from 6 to 8 repetitions. So this one's going to take you longer because you're going to have to hold that for time. But I want you to try that many all at once in one session. So you're going to do this twice a day along with all the other exercises in this program. So again, 2 sets of 6 to 8 repetitions. If you find that you can only hold that for a few seconds on your operated leg, that's okay for right now. Because if you keep up with it, it's going to improve really quickly. I have seen that with all my patients over the years, and you'll be surprised how soon you start to see improvements. And just have fun with this exercise. Most of my patients like doing this. They like seeing the improvement, and they think this is fun. So just have fun with it, and you have one more video to view for this exercise program.